presented by Dr. Kalyan Varma, Professor, Forensic Medicine and Toxicology. Are you concerned about the hidden dangers lurking in everyday substances? Inorganic irritants encompass a range of substances, both metallic and non-metallic poisons, that can cause severe harm when they come into contact with the human body. Today we will delve into the effects and characteristics of these potent substances. One might wonder, with which disease are the clinical features of acute arsenic poisoning mimicked or confused? The answer is cholera. Let's compare the two. In acute arsenic poisoning, the sequence of symptoms typically begins with pain in the throat, followed by vomiting, and then purging. In cholera, the order is reversed, starting with purging, then vomiting, and finally pain in the throat. The vomitus in arsenic poisoning contains mucus, bile, and blood, whereas in cholera, it is watery and lacks these components. The stool in arsenic poisoning is dark-coloured and bloody, but later becomes rice-watery, while in cholera, it is rice-watery from the start, without blood, and is passed in a continuous involuntary jet. Tenesmus and anal irritation or pain are present in arsenic poisoning but absent in cholera. The voice remains unaffected in arsenic poisoning, whereas in cholera it becomes rough and whistling. Conjunctiva is inflamed in arsenic poisoning, but not in cholera. Laboratory investigations will show arsenic in the stool for arsenic poisoning and Vibrio cholera for cholera. Typically, arsenic poisoning affects generally one individual and can be suicidal, homicidal or accidental, while cholera affects many during an outbreak and is accidental. What are the clinical features in a case of chronic arsenic poisoning? The progression occurs over several stages. The first stage involves gastrointestinal symptoms. The second stage is dermatological, featuring raindrop pigmentation on flexors, nipples, lower abdomen, temples and eyelids, along with hyperkeratosis, leukomelanosis, Aldrich-Mees lines and alopecia. The third stage affects neurological aspects and the fourth stage neuromuscular, presenting as neuropathy. This peripheral neuritis often manifests with glove and stocking type of anesthesia and is usually a symmetrical sensorimotor polyneuropathy, often resembling Guillain-Barré syndrome. What are Mace lines? These are white transverse lines visible in the nail plate, typically seen in cases of chronic arsenic poisoning. They serve as a telling indicator of the condition's impact on the body over time. In which poisoning is raindrop pigmentation found? Well, it is found in acute arsenic poisoning. What are the clinical features in a case of chronic lead poisoning? Let's remember them with the mnemonic flair. 1. Facial pallor. 2. Lead, which includes lead line, lead palsy, lead encephalopathy, lead osteopathy and lead colic. 3. Anemia with basophilic stippling. 4. Retinal stippling. 5. Effects on reproductive and renal system. And 6. General manifestations. What is the cause of facial pallor in chronic lead poisoning? It is due to vasospasm, that is, constriction of capillaries, particularly around the mouth. It is the earliest and most conclusive sign of chronic lead poisoning and is independent of the degree of anemia. Now, what is Bertonian line? It is the bluish-black discoloration of gums, which always occurs on the edge of the gum at its junction with teeth, usually in the upper jaw. What is the mechanism of development of lead line? In people with poor dental hygiene, the decomposition of food in mouth leads to the formation of H2S, or hydrogen sulfide. The hydrogen sulfide, so developed, reacts with the lead in tissues to form black PBS, or lead sulfide. The subepithelial deposition of black lead sulfide granules leads to the formation of lead line. The line disappears in 3 weeks or less if 1. The mouth is kept clean, or 2. The carious teeth are removed, or 3. The patient is removed from the occupation or the place of exposure. What does lead palsy include? Initial symptoms before development of wrist drop and foot drop are pain in large joints, tremors, cramps, numbness and hyperesthesia, which get increased by voluntary movements. Wrist drop. All extensors of the wrist are affected except supinator longus or brachioradialis. Foot drop. All extensors of the feet are affected except tibialis anterior. In cases of chronic lead poisoning, anemia often presents initially as microcytic and hyperchromic, but it later transitions to normocytic and normochromic. A key feature to observe in the red blood cells is basophilic stippling, which appears as discrete dark blue pinhead spots within the cytoplasm. So, what exactly is the nature of abdominal colic in chronic lead poisoning? Well, it typically manifests as sudden, nocturnal and extremely severe. The pain is spasmodic and intermittent, lasting just a few minutes. Interestingly, it can be relieved by applying heavy pressure or by bending forward. The primary component of Sindor is mercuric sulfide, also known as HGS. Additionally, it contains lead tetroxide, though in lesser quantities, which is chemically denoted as Pb3O4. What are the clinical features in a case of chronic mercury poisoning? Well, let's consider the mnemonic ATM-EMM. First, there's acrodynia, often referred to as pink disease. Then tremors, also known as mercurial tremors, Danbury's tremors, Hatter's shake, or glass blower's shake. Next we have mercuriolentis. Erethism is another symptom, also known as mercurial erethism or Mad Hatter. Additionally, membranous glomerulonephritis can affect the kidney. Lastly, there's Minamata disease, first identified in 1956. What is acrodynia? In cases of chronic mercury poisoning, acrodynia manifests as the hands and feet becoming puffy, pinkish, painful, and paresthetic, with peeling skin. There's also redness, vesication, and desquamation of the peripheral parts of limbs, including palms, fingers, soles, and toes. What is Hatter's shake? In chronic mercury poisoning, the tremors are known as Hatter's shake, or mercurial tremors, or Danbury's tremors, or glass blower's shake. Two types of tremors are seen. Firstly, resting tremors, which occur at rest, and secondly, intentional tremors, which are more pronounced during purposeful voluntary movements and absent during sleep. These tremors usually start in the hands, leading to shabby and shaky handwriting, then progress to the lips and tongue, causing stammering and hesitation in speech, and ultimately affect the arms and legs, resulting in a staggering gait. Presented by Dr. Kalyan Varma, Professor, Forensic Medicine and Toxicology, I bet you didn't know the psychological effects of chronic mercury poisoning, also known as mercurial erethism or the Mad Hatter syndrome, are particularly severe. It's commonly seen in industries like mirror manufacturing firms. Individuals may suffer from a range of symptoms including anxiety, depression, shyness, timidity, irritability, hallucinations, delusions, and even suicidal melancholia. The condition can also lead to manic depressive psychosis, famously referred to as Mad Hatter, as well as insomnia and loss of memory. Metal fume fever is an acute flu-like illness caused by the repeated inhalation of fumes produced when zinc or other metals, such as copper, iron, manganese, chromium, ferrous, cobalt, nickel, cadmium, lead, antimony, silver and aluminum, are heated above their melting point. What is the antidote in acute copper sulfate poisoning? The answer is penicillamine, Editor, and BAL. Additionally, Prussian blue is an antidote given in acute thallium poisoning. What are the clinical features in a case of acute phosphorus poisoning? In the first stage, due to local irritant action on the gastrointestinal tract, there is a garlic-like taste and smell, and the patient may notice their surroundings luminous in the dark. Symptoms include burning pain in the mouth, throat and stomach, leading to intense thirst, vomiting and diarrhea. Fumes may evolve from the stool known as smoky stool syndrome. In the second stage, which is a dormant phase of 2 to 3 days, signs and symptoms of the first stage subside in intensity, and there is marked improvement of signs and symptoms for the next 2 to 3 days. The patient may wish to go home, but he should not be discharged. In the third stage, due to the absorbed poison, symptoms of the first stage reappear with increased severity. This includes CNS damage such as encephalopathy, convulsions, flapping tremors of hands known as asterixis, delirium and coma. Hepatic failure follows, initially with liver enlargement due to fatty degeneration, but later on the liver shrinks due to necrosis, resulting in acute yellow atrophy. The liver becomes half the normal size, has a marbled color with alternating red and yellow areas, and symptoms include jaundice and pruritus. A mousy odor of breath known as fetor hepaticus is also present. Finally, hepatic encephalopathy occurs. Additionally, renal failure, bleeding tendency due to prothrombin deficiency, priapism and death due to shock are possible outcomes. What is phossy jaw? It is the osteonecrosis, sequestration and osteomyelitis of the lower jaw near the decayed tooth. It is seen in chronic phosphorus poisoning and chronic use of bisphosphonates. It is associated with pain in teeth with swelling of the jaw and multiple sinuses discharging foul-smelling pus.